Do you support the health care legislation as Mitch McConnell has currently put it together?
I probably will, because I think it's better than Obamacare, which is a disaster. We're down to one exchange in South Carolina. Premiums have gone up about 100% throughout the country. What you've done with Obamacare is basically you've mandated a policy that most businesses can't afford to offer their employees. They drop coverage on their employees. They pay a fine. The employees go into an exchange, and if you make $50,000 or $60,000, you really get screwed. If you're a real low-income worker, it's for free. So this has been a redistribution of wealth from the middle class and upper-income Americans to provide health care to lower-income Americans for free. What I want to do is have a balanced approach. I want to lower premiums for working people who make $50,000 or $60,000, and that's going to mean has to be more competition. The best way to lower the price of a car is for Mercedes and other German car companies to be able to compete with BMW on price and quality. What's missing in medicine is price and quality as a competitive element. This bill has, I think, more competition, and the prices will come down, but I don't know if we're going to pass it. And if we fail, here's an idea. 10% of the sick people in America, people with cancer who have been dealt a bad health care hand, account for about 90% of all the expense. What if you took that 10% population and put them in a managed care system that the government would share responsibility with the private sector, federal and state co-shared responsibility, take them out of the private market? I think that would do more to lower costs for the private sector than any single thing I could think of. And the really sick people would always have coverage. They'd have to pay based on their ability to pay, but you'd take out of the marketplace what drives up most of the cost. And if you had a managed care concept, you'd get better outcomes for the very sick people. That will be my plan B.